Okay, we are talking about program evaluation. This is week 3, and we're going to talk about process evaluation. So process evaluation is or at least the goal of it is to understand your program more fully, to figure out whether or not you need to make any improvements to it. And the way that you do that is you look at the process itself. How does your program actually function? And then who are you providing services to? Evaluators usually will distinguish between process implementation and outcome or impact. So if you're looking at process, this is what mainly your program managers, the people who are doing the day-to-day work, they're going to be focused on, because they want to know whether or not that process is working, so that they can make, minor course corrections, right? Outcome, that's mainly what policymakers and legislators and people who are going to be considering whether or not to keep a program. They're going to be thinking about accountability. This is also a big deal in accreditation. They want to know whether or not the outcomes are you're achieving your outcomes. So if you look at the process, in a process evaluation, the process is central as opposed to the outcomes, and everything that impacts that process. So your resources, things that have happened prior to it. The resources are your inputs, basically. You're going to have limitations or boundaries. You're going to have participants in your program, those customers that are going to influence the process. And then, your outputs will also, will have an impact on the process down the road. Okay, so this is the process evaluation program. When you're interested in doing a process evaluation for your program, you're not really interested in causation. You're basically interested in whether or not there's something wrong with the process, and that's what's causing a problem, something not to happen within your program. So with the use of a process evaluation, you're going to be correcting problems or deficiencies within a program. It's very problem-solving oriented. It's different from something that's more outcome focused. And you'll find that most agencies do some level of process evaluation without even realizing that that's what they're doing. It's a great thing to use if you're thinking about making changes to your program. Okay, so you have inputs, you have the actual activities of that agency, and you have outputs. That segment of it is what the program staff is actually doing. This is what the program is doing. This is what staff is doing. The second half, outcomes, these are the results of your activities. So you can think of inputs, activities, and outputs as one part of one sphere, and you can think of outcomes as a different sphere. Of course, the inputs, the activities, and the outputs become your process evaluation, and then your outcomes are what you focus on for an outcome evaluation. So why would you study implementation of a program? It's usually pretty much overlooked. There's usually a lot of change going on during that time period. It's usually, when you're talking about change, there's usually a big resistance to change, which can be very disruptive. And there's an entire body of literature that just talks about resistance to change, with particular emphasis on technological changes causing some of the most, the biggest resistance to change, because obviously you have to have a lot of training and resources, and it's just really stressful, I think, on workers when you make big technological changes. If you want to plan a change to a program, you want to have a clear agenda, you want to be very specific, you want to assign different responsibilities for that change to people who work within the program, and you want to manage and monitor the implementation. So if you monitor that implementation, then you can make course corrections to improve your program. So process evaluation is useful when your outcomes don't happen. you might be able to figure out why by dissecting the process and seeing where there are problems. If you have really good outcomes, you might want to do a process evaluation to understand which components of your program are the most helpful. If you newly implement something, it might be too early to expect big outcomes or big changes in your participants. So sometimes evaluation might be, any kind of process evaluation might be difficult, and outcome evaluation impossible when you're in the early phases. But you can always collect some data, process data, which is easier to look at. We're also going to talk about coverage and bias. Coverage is where the program is reaching the appropriate population, the people that you want it to reach. And so you can have issues of whether or not people are receiving services, whether or not enough people are receiving services. You want to see whether or not people are actually using the services that they receive. Did it go to the right people, the intended clients? And then what is the makeup of those people? What are they like? Are you only picking the cream of the crop, the people that are most likely to have a positive outcome, and not hitting the people who maybe need the services the most? Are you underrepresenting? Are you missing? There's some people that you're missing. And then you want to know who's completing the treatment, who's receiving full services, and for those who dropped out, what are those people like? You want to make sure that there's good communication, that your program exists so that people know to come to your program. There are some common coverage problems. There could be a self-selection bias. You could have over-participation, or like I said, you could have that creaming. You could have under-coverage, limited funding, poor access. You could maybe too broadly define your population and get way too many people joining on. We had that problem with, and it's a common problem when you have a mental health court that services people who are persistently mentally ill. They have these chronic conditions. A lot of times people don't understand mental illness, the nature of it, and so the folks who are referring people to you will refer all kinds of people to you that might have some signs and symptoms but aren't actually within the population that you want to reach. So a lot of times you can reach way too many people that don't actually fit within your program. All right, so you want to deal with whether or not service delivery and support functions are consistent, that you have standards and certain specs that you want to meet, so that you give the right amount, type, and quality of services and people don't have to wait too long. Good example, again, with mental health issues, most mental health facilities are overburdened, and so they can't get to everyone in a timely manner. And that can be a real problem. For example, with competency evaluations, for example, I worked with the state of Kentucky. They were having problems with one facility that was taking too long to evaluate people. It was taking more than 90 days, and competency evaluations are supposed to be done in less than 30 days. They had staffing issues, so that was part of the problem. And you have to have people with certain degrees that are harder to come by. So you want to look at whether or not a program is really well organized, and whether or not the staff is working well together, whether or not they have adequate funding and resources and facilities. I had to help the mental health court that I helped create in Kentucky. They didn't have facilities, so I had a law office, and I let them work out of that for a little while till they could find a place of their own. You want to think about compliance, and you want to think about legal standards. For example, we've had judges who were only allowed to handle misdemeanor cases, but we wanted them to handle felony cases for some of these specialty courts, so we had to go and get permission from the state Supreme Court to be able to do that. Also, a lot of times with an evaluation, you can figure out whether or not the participants are happy with the services. They might be able to tell you about some services that are more helpful than others. And then a lot of people, once they're in a program, they complete the program, they leave the program, and their problems don't go away. They will resurface, they'll come back, and you want to be able to follow up and make sure that they're still receiving help even after they're out of the program if it's necessary. So there are some common problems with implementation. You can have obviously poor quality and incomplete intervention. You can have inappropriate interventions. You can have people that resist the program. You can have a lack of standardization, and then you have all kinds of problems there as well. All right, so think about coverage versus function. Is the program serving the clients it was intended to serve? How many direct contact hours does each client receive? What is the average age of program participants? What percent of clients actually complete the program? Is this a coverage question or a function question? Are these coverage or function questions? So consider that. If you're going to conduct a process evaluation, you can collect numbers, quantitative numbers, or you can interview people. You can do qualitative research. It's always best to try and do a combination of the two. Qualitative methods include case studies, interviews, focus groups, observing people while they go through the program, looking at meeting minutes or progress reports, whereas quantitative, usually you're handing somebody a survey and they're filling out that survey. And that information typically comes from program participants. It can also come from people who work the program. You can also look through agency records to just get raw numbers, raw data. So, in summary, program process evaluation will tell you if your program is operating as intended. It'll tell you whether or not you have coverage problems, whether or not you're functioning at the organizational level, whether or not you have some self-selection under coverage, over coverage problems. And then it'll also help you deal with those incomplete interventions where you're giving the wrong intervention or the interventions aren't standardized. So we'll talk about this more in class.